Hi, my name is Komal Farooq, and today I'm going to discuss about the lower back pain. And I will discuss some common causes of the lower back pain and also focus on the home remedies and management techniques which you can do at home just to overcome that lower back pain. And also I will discuss the red flags as well related to lower back pain so that you can seek medical assistance. Otherwise, it can lead to severe complications. So first of all, the most common cause is the disc dehydration. As I mentioned in my previous video as well, that it's very important to understand that thing, because when we start growing older, what happens? The fluid inside the disc is start getting lower, and that causes the bones to come closer, and that's how we most of us they suffer from the degenerative changes, and that can cause you spinal arthritis, wear and tear in your spine. So it's very important to keep yourself hydrated with the specific supplements, which I always mention as a fish oil, and that lubricates your joints. So this is very important thing. And it can, if the or discs are dehydrated, this can cause, you can see in this picture that it's start reducing the height of the disc, and the bones are coming closer, and they are causing the arthritis. Arthritis is basically, it's the D shape or wear and tear of your bones. So that's what happens with the disc dehydration. And these are the some common problems which are mentioned here, which can cause you degenerative disc bulge, herniated discs, and thinning of spine, wear and tear, osteophytes. So what happens when the bones start rubbing together, when they come closer, and then they D-shape, and sometimes they form the spiky nodules, which are called osteophytes, and they start pressing your nerves, and even they can cause damage to your nerve. And this is another illustration of this dehydration. And as you can see, the bluish thing, which is at specific height, and how it should be normal. And when it start dehydrating, and how it start affecting your spine. So it's very important because our spine is very, very important, because it contains the spinal cord, which is connected directly to your brain. So it's very important to understand that thing. This is another cause of the lower back pain, which is most common because of the poor posture. As we don't sit properly, maybe our mattress are not good, and they can lead to lumbar lordosis, excessive curvature. And what happens in that thing, like we feel like it's excessive curvature, and it leads to we feel like our belly is very protruded, but usually it's not the fat in our belly, it's just the curvature of the spine that make you feel obese. And what happens when your spine is not in a good curve? Like as you can see in this picture, it is too much curve. So you can imagine like the spine, it's getting more closer at the back side. It's getting more closer. And when it happens, it start pinching the nerves at the back, which are very important because they go to our legs, and when it gets pinched, as you can see here, the disc bulge, it start pinching the nerve, and that's what happens. And then most of our we suffer from a sciatica, a problem where one of our leg feels numbness, pins and needles, and sharp shooting pain, which radiates down from the lower back down to even to the foot. And that's because of this disc herniation and nerve impingement. And this nerve impingement is caused by the disc herniation. And it's very important to understand that thing. So that's why if we get the nerve impingement, and we get the sharp shooting pain in our leg. So basically it comes from our spine, but we don't know where it's coming from, and sometimes we feel like our leg is getting tight, stiff, but it is because of the nerve impingement. Here I'm going to discuss some important points related to the nerve impingement and the serious consequences and red flags where you have to seek the medical attention. So basically, what happens when our disc is impinged, like it is dehydrated or it's damaged? I'm gonna discuss a case. I had a client. He was working and he did the lifting, heavy lifting, and he heard a popping sound in his spine. And after that, he felt a sharp shooting pain in his lower back, and he was unable to move, even he was unable to sit. So the thing was, when he felt the pop, what was the reason? His disc was burst, and that fluid which was enclosed in a disc, it came out of the disc, and it started putting the pressure over the spinal cord, the nerve, which is the main part of the spinal cord, and it start covering the nerve and start putting pressure. And what happened, it caused the numbness in his both legs. So in case if a client is suffering from such problem, even without lifting and carrying, or suddenly he start feeling numbness in his both legs and he feels like his legs are getting weaker, and also he feels pins and needles, and he feel like he cannot walk. And also another thing is the bladder bowel dysfunction, like he feels like he can't control his bowel movements, and also he feels difficult in urinating, and urinary incontinence problems. So if something like that happens, like there are some these problems, the complications which he's feeling and which are not normal to him, so I will highly recommend to consult seek medical assistance, or to consult medical specialists, because they are not the normal symptoms and they are affecting your spinal cord. And you can and this spinal cord is directly connected with your brain, so it's very important to seek medical assistance in this condition, because that's the spinal cord, the yellowish thing, that's the spinal cord. And if any part of the spinal cord is irritated, either in the neck region, either in the lower back region, it is not good for us, as it can lead to permanent disabilities. So that's very important to understand that thing. So if any one of you is suffering from lower back pain or neck cervical pain, so if they feel unusual symptoms which are not normal, for example, in cervical spine, if they are feeling bilateral pins and needles and numbness, and they feel like their arms are getting weaker, and they are feeling they can't lift anything or something like that, so it's very important to seek the medical attention. Otherwise it can lead to disability with anything like arms or the legs. So that's basically the cauda equina syndrome, where the fluid, as I said, the disc was popped and it distributing towards the spinal cord, and it was disturbing the normal conduction of the nerves. All right. So here is another condition which I wanted to discuss with you. Like I had a case in which my client reported. She came to me and she said that she was sitting in a toilet, and she sat for a bit longer as she was constipated. So she sat a bit longer on the commode. And what happened? She said that when she tried to get up out of the toilet, she couldn't, and she felt numbness, weakness in her both legs. and she couldn't even walk, and she was at bed rest for 2-3 days. And after she came to me and she was limping, and she told me that that's the reason, that's the main cause, that she was in the toilet, and after that she couldn't walk, and all these things. So when I assessed, then I found out that due to prolonged sitting on the commode, as you can see, it's a hard surface. So due to prolonged sitting, it caused the pressure over her both sciatic nerves on both sides. And if the nerves are under constant stress or pressure with the hard surface, for example, if we are sitting on the hard chair as well, so that's when what happens, that the nerves, that they start damaging. And that's what happened with her. And her as her nerves were under prolonged pressure, so they start losing their conduction, and then she felt the pins and needles and numbness and weakness in her both legs. But luckily she is fine now, and now she's doing very well. But that was the case. So I want to tell you one thing, like even if you are using a commode, I will highly recommend you not to use it for a long time. And because what happens, like it's a hard surface, it's not normal, and it's a hard surface, and it can lead you to the permanent disabilities, permanent numbness, weakness in your legs, and it can lead to paralysis. So please try not to sit for a long period of time in the toilets. And another recommendation I want to give you, for example, if you're using the commode, I will highly recommend you to use a stool under your feet to maintain a proper angle, because what it's gonna do, like if you will sit in a certain angle in a commode, that can align your intestine in a certain angulation, and that can ease your bowel movements as well. But it's a bit off topic, but it's very important to discuss. So that's why I thought I should discuss with you, that it helps to release the bowel, make the bowel movements easier. And most of us also suffer from hemorrhoids and piles, just because when we are sitting in the toilet and it gives you strain your rectum and intestinal muscles. So that's why the walls, they start putting pressure, and then they make the fissures and the hemorrhoids, all these type of things. So that can also cause you hemorrhoids if you are straining too much while in the commode. And so that's why the stool is very good technique to prevent these type of problems. Now I'm coming back to my own topic, lower back pain. So what to do if you are having lumbar lordosis, like excessive curvature in your spine, and you are feeling like you are very obese, or your tummy is very protruded, or you are having a severe lower back pain, or if you did heavy lifting at work and it caused you a pain in your lower back. And sometimes if you were walking for a long period of time and you felt the pressure on your lower back. So what to do in these conditions? I'm going to share some tips with you, home remedies, and it's really going to help you. And one of the technique which you can do, which I recommended to my clients and I have seen a positive feedback, is this technique. Like what you're going to do, like you have to go in a face down position, and you need to put a pillow or a cushion, or even if you have anything like a towel. So you have to simply use it under your belly, below the navel. So what will happen? It will decompress your spine. It will push your spine to go back into its normal position. So that's really helpful for the disc herniation problems, because the fluid, you have to do it for 30 to 1 hour in that position, so that what will happen, the fluid, it start coming back to its normal position, like normal region. So it will come back to its normal area. So what will happen when the fluid will come back, the pressure over the nerve will be released, and it will give you instant relief. And also you can apply ice. That will also help you to reduce the swelling in your spine or the nerve or the disc. So it's very important, because I don't recommend heat in this area, because what happens when you use the heat, as your nerve is already irritated and it's swollen, and your disc is also irritated and swollen, and if you use the heat, you can imagine it's causing more swelling, it's causing more inflammation, and it can cause you terrible pain. Initially, when you start using heat, you might feel comfortable, but after some time it's making it worse. So I don't recommend heat, I recommend icing, because ice, it decompresses, and it causes the reduces the swelling. So it's very important to use ice instead of heat. This is another technique. Here is another technique, like if you you don't want to lie on the bed, you can use a table or something that you can lean on it, but you have to put a pillow under your belly, so that it will give you a proper curve, and it will decompress your spine instantly. As you can see in the picture as well, like it's showing that this on the top right corner, that the fluid, as you do this technique, the fluid is start coming back to its normal position. That's another technique you can do. So here I can explain you in more detail, like a bulging disc before. You can see that the disc, it's bulging outside. It's circular rounded things. It's the disc bulge. It's bulging outside. And when you do this thing, the pillow technique, it decompresses it. It's this pillow technique, this one, and this one is good for the people who have posterior disc bulge, and usually disc is posteriorly bulge. It's very important, so that's why we always recommend MRI scan to understand whether the disc is bulge posteriorly or laterally, because if you have a disc bulge on your left side or right side, not posteriorly, so that means you have to do this technique in the sideways. Like for example, if you have for example, like if you have pain in your right leg, that means the disc is bulged towards the right side, and it is causing pressure over the right nerve. That's why it's giving you pain in your right leg. So what you have to do, you have to, then it means that if you will do this pillow technique in face down position, you might feel no benefit, and you might feel like it's not working. So what you have to do, you have to do the same technique, but in the sideline position. Like you have to lie sideline, and your left side should be underneath, and your affected side should be at the top. And then you have to put pillow at the side, at the left side, so you can get a proper curve in your right side. So what will happen, the fluid is start coming from the right side back to the normal position, and after some time you start feeling the improvement, and the pain in your lower leg start getting better. So you have to understand, either you have pain in your left leg, either you have pain in your right leg, and then you have to position yourself in a sideline. If it is in your right leg, then you have to position while lying on your left side, and your affected side should be at the top, so that you can get a proper curve, and then it will decompress your spine. This is another recommendation. It's a back stretcher. Usually it is used by the females to get a proper curvature in their spine, those who have the straight lower back. Sometimes it's not the lumbar lordosis, sometimes it's the back is very straight, so they need a natural curvature, so they use it to create a curve. But I recommend this back stretcher for the people who don't want to use the pillow or any kind of a cushion or towel. So I recommend them the back stretcher. So what they have to do, they have to lie down, face down, not in that position, but in opposite to that one. They have to lie down, face down, and this back stretcher should be at the level of the navel. So that can also give you the decompression. Usually this is the technique, but in case if you have pain if it is not helping, and if you have to try it in the side lying position. And the cord therapy, like icing, I already recommended. You can see that it gives you pain relief, acute pain from injuries, and then it works for sharp sudden pain. It reduces the swelling. It also numbs the pain. It's very, very, good remedy. It's better than taking any medication, because medication gives you just a temporary relief and the pain comes back. But if you use the ice, that means you are treating it naturally. So it's good for you to go for ice therapy rather than going for any medication. Thank you so much for listening, but I also want to discuss some important points as well. If in case if you have done all these remedies and you feel like nothing is working for you and you still have the pain, that means your problem is not normal, it is serious. And that means you have to seek medical assistance. Either you have to go to urgent care, either you have to consult a physio so that they can give you a proper direction. Thank you so much for listening, and I hope my video helped you, and I will try my best to make more and more videos for you, which I feel like it's very important to do, give you public awareness, because once a few simple techniques can prevent you from serious complications. Thank you so much, and remember me in your prayers.